It does.
Let's talk about your third piece of your stool. We talked about the first leg, which is the Meals on Wheels, and then we talked
Mhm.
about the Senior Care Center. Let's talk about the third leg, the transportation. So tell us a little bit more about, who qualifies and, what the cost is and how does it work?
Yeah. Well, again, so transportation, there's a number of things. Whether it's picking people up to getting them to our daycare is one component. We pick them up around lunchtime to bring them to our senior cafes. A senior cafe is just it's kind of like it's basically a little tiny restaurant that we bring 40, 50 people together, seniors that they live within just a couple of miles of one of our locations. We'll pick them up and drive them there. And after lunch, we'll take them back. We'll pick people up to take them to medical appointments, so they could literally call us up and we'll get them. We'll get them to the appointment, wait for them, or come back for them if it's something a little bit longer. We get paid for that with some federal government dollars. We get paid for it from some state of Florida dollars, which is helpful. Again, if anybody's got a contact with PSTA or Florida Department of Transportation, that could help us. And so that funding lets us to provide more transportation. Our transportation has had a big hit with COVID, people just not wanting to ride together for fear of catching a virus. So we've been riding around with vans with just 2 or 3 people in them and really haven't got them back to fully operational. It's something we need to do. But we work with communities. So if there's a residential community that want to contract with us to take people to the mall or maybe to the movie theater or to a dinner theater, we make those arrangements with those communities. And then some of those things we just charge a flat fee, and that they divide it up by the number of people on the bus. It's very inexpensive.
That's great. I know you guys have different programs throughout the years, like, for example, Shine counselors, during the Medicare open enrollment. Tell us about your, different programs you do different times of the year. I know you have March program, the meals. Where you bring
So the National Meals on Wheels does a March for Meals that they do. And that's when we actually contact community leaders. So whether it's county commissioners, senators, representatives, city commissioners or city council members, mayors, business leaders, to actually come and do a Meals on Wheels route. It might be 5 stops, it might be 10 stops, it might take you a whole hour, but it will give you a whole different look as to what Meals on Wheels really is and what it does for the senior. And that's a fabulous thing that we do in March. In September, we have a great connection with the St. Pete Yacht Club and Sailing Association. For 12 years now, they've done a fundraiser for us, a sailing regatta. And they've taken it on themselves and done it for us. And we've been the benefactor of that for 12 years, over $100,000. So anybody who's got an interest in sailing, that comes up in September. We do. In December, we take seniors everywhere in our buses at night to see the lights, for Christmas lights. They love that, and that's one of the more popular things that we try to do for the seniors, really to get them out and just to help them get engaged more in the community. So we're trying to always do something a little bit different. We always have fun things at the dining sites throughout the year. Heck, last year we dragged, not last year because it was COVID, the year before, we would bring barbecues out and cook hamburgers and hot dogs. They would have a picnic, and they thought that was the greatest thing, better than all the regular food they got. And to have a barbecued hamburger and hot dog and a ginger ale soda or something was a highlight for them. And when you see that, you see how excited they are to that, it makes you want to do more of it. And again, that's where I say I have the greatest job, because I get to see that and be a part of that all the time.
Now with COVID, you guys have to think out of the box. And I saw on your website you have a virtual, cafes and virtual program. Tell us how you have to be flexible in COVID.
Yeah. Well, when COVID hit, we didn't have we talk about essential workers. We didn't have a choice. If we didn't come to work the next day, seniors went hungry. And with all the seniors that weren't going to grocery stores and weren't going out to eat, like I said, when our numbers went from 1,000 a day to 2,500 a day, we had to really step up. Our staff worked through all of it, missed nothing. Our volunteers, we got more when a time when people were going inside, the volunteers were coming back outside and coming to us. So we were so grateful to our volunteers to what they did for us. we brought the injections in. We actually had volunteer nurses that worked for us that were volunteering for Meals on Wheels delivery that were nurses, retired or semi-retired. And so they provided injections. So we were able to give our clients, our consumers were able to get injections, our volunteers were, and our staff were, and family members. So it was a great partnership we did with the Florida Department of Health. And we were really happy to be able to do that. And our volunteers were very happy we were able to do that for them. But we had to close things. Daycare had to close for a few months. Now we had to buy very expensive equipment to clean everything, clean our buses, disinfect our buses after every trip. So COVID presented quite a challenge to us. What was great, we were already because we're a food service provider, we were very kind of conscientious when it comes to health and safety issues. And so we were already a long way towards a lot of the disinfecting and cleaning and sanitizing measures that were put in place because of COVID. We were already there and taking care of that. Again, with our food and with our daycares, we had to do that anyway. So it was a bit of a challenge, and it hit us hard financially because a lot of things, like I said, transportation and 50 vans, we still owed them, and we still had to pay insurance for them, and they were sitting empty. And again, everybody had a tough time, but again, some of that hit us hard. But we just kind of had to plow through and keep going. Oh, COVID had some silver linings. I hate saying it because I know people died from it, and I understand a lot of hardship. But it took the people off the waiting list. It brought more money to the table. We actually got to do some really innovative partnerships with restaurants that were closed. We were able to have them reopen because we would get a couple of hundred meals from them to deliver. So there was a restaurant partnership we did. So we at one point I think we had 10 or 12 restaurants in Pinellas County that were paying their staff, and they were serving more meals to us to deliver than they were producing on a regular basis. So it kind of kept them in business. That was a plus. Being able to take people off the waiting list was a plus. We were able to get some funds for a number of different things, initiatives to help us with disinfecting and doing less touch and more, less hands-on basically, and more hands-off kind of things we were able to do with technology.
Oh yeah, with every, difficult time, David, comes, as you said, silver lining, and you gotta do the best you can.